I'm Dr. Kayla Eckart. I'm a naturopathic physician and have a practice here in Scottsdale, Arizona. I also offer virtual groups and retreats to individuals who are looking for just a whole nother layer to healing. I found out about LOTUSWEI 10 years too late. So once I knew that naturopathic medicine was an option, it was a really clear path. I knew that I could use herbs and diet and lifestyle and nutrition, that supplements were a really valuable tool. I even knew that I could do home births and a type of manipulation similar to chiropractic, and the path was clear. But there's something that happens when you enter a medical school program and you're trained to be a primary care physician, to order all the labs and the imaging, to diagnose and label and treat. There's something that's lost in that, and I think it's taken me 10 years to get back to it. I think if I would have found flower essences before medical school, I would have felt confident that I had the thing that I needed to really help people heal on a really deep and foundational level that I don't know if I would have gone to medical school. The system that LOTUSWEI provides is so unique because the patient, if they're able to look at a set of flowers, if they're given the tools, if they're given the visual stimuli, and they're asked, if you ask them to choose what they're drawn to, they will intuitively select what they need as treatment. So they turn into their own doctor. And as a physician and as a doctor, which means teacher, docere means to teach, that's our job, is to teach them what's available for them to heal. When you put it back on the patient, they're already a master of their lives. They know what they need. And so again, if you remove yourself completely and you just provide the tools, they select the flower, they select their treatment, they start the healing journey, and you get to just sit back and watch the beautiful thing unfold. There's something that's happening right now, and I can't quite put words to it, but it's really difficult as a practitioner when things that have been working for a long time are no longer working. I hope I don't sound insensitive. I don't mean it that way at all. But when someone comes into my office and they have on their intake, their symptoms, the things that they want help with, in the back of my mind, I hear this little voice that says, I don't care. And it's not that I don't care about the patient. It's not that I don't want to help them. It's that the labels that we've attached to the symptoms or the syndromes that we've decided to diagnose someone with really don't matter, because the way you treat anything is the way you treat everything. And if you're incorporating both the physical body and the mind and the soul, especially the more emotional realm, those things that tend to bottle us up and keep us from attaining our full potential in the first place, that's where healing happens, no matter what label they've been given. So I would encourage, if you're in your practice and you feel a little bit stuck, they have an event coming up in November, and it's going to be beautiful because we all have these little pieces of information, and we can't quite fit together the puzzle. And I think that if practitioners gathered together and brought the little pieces that they have discovered and that they know to be really true, we could tie it all together and maybe learn a little bit better about how to move forward in addressing our patients in this new world that we're living in.